Good morning, everybody, and welcome to this session about arts and health. As I'm sure you're aware, it's an area with a sort of growing prominence and awareness, massively broad and complicated area, I would think, and an area in which I have absolutely no expertise whatsoever. So I'm relying heavily on our wonderful, varied and multi-experienced panel to provide all the grist to the mill of learning and discussion that we're going to have over the next hour. So first of all, I'd just like to go along and find out who we've got before us today.
I'm Alex Coulter. Do you want to see my job?
Yeah.
So I'm Director of Arts and Health South West, and I also chair the Culture, Health and Wellbeing Alliance and provide the project management and secretariat for the all-party parliamentary group on arts, health and wellbeing.
And I'm Cerin Mills, and I'm the live events programmer for Arts Alive.
I'm Victoria Hume. I'm the Director of the Culture, Health and Wellbeing Alliance. So Alex is actually my boss, just so that you understand the dynamic.
Is that why I'm between the two?
Yeah, she positioned herself.
And I'm Paul Whitaker, and I am one half of 4 in 4, which is a arts and health multidisciplined company with my partner Tamsin Griffiths.
Thank you. I'll be asking each of the 4 panellists to give a fuller presentation of their experience and kind of broad insights, which hopefully will then stimulate questions and discussion from all of us. It seems to me that as promoters and scheme managers, there are maybe 3 sort of broad areas relating to arts and health. One is the question of access, so in terms of how are we providing the best possible opportunities for everybody, regardless of what health issues they might be facing, to enjoy the art that we are presenting. But from the health aspect, I think we all know that arts are good for us. They make us feel better. And I think there's a question about how we can better promote and advocate for the benefits of the arts in a health context. I think it's an awareness that seems to be seeping gradually more into the powers that be. And there's also the question of cultural activity that has a specific aim to address health issues, either by exploring them like Paul's piece or by providing participatory opportunities which then have benefits for mental and or physical health. And hopefully we'll explore all of these things. So, without further ado, Alex, would you like to give us a bit of a fuller picture of what you've been up to and what you've learned from it?
Sure. Well, we were asked to consider a few questions to give a frame to what we say. As I said, I'm Director of Arts and Health South West, which is a regional learning, advocacy, networking and development organisation covering a largely rural area of the country. And we're really for anyone who believes that the arts and creativity can make a contribution to health and well-being, individual and community. We've been developing a collaborative regional strategy across the South West with a working group which includes Mark Hellier from Take Art, and they have particular experience in social prescribing. They're doing something called Wordplay, some of you will know about that, which is mental health poetry performance in a referral process, a social prescribing process. But I did just want to add in one personal memory here. So I used to run the arts programme at Dorset County Hospital, and so I know the Dorset arts and culture ecology quite well. And I was talking to Yvonne Gallimore this morning at breakfast from Arts Reach, and the most enduring and vivid memory I have of performance is the Red Shoes by Knee High on Kimmeridge Cliffs with the sea behind and the stars above in about 2001. And, that was a formative experience for me personally. So I do think that the rural touring context is a really exciting one for us to be connecting with around arts and health. So I've worked in this area for over 20 years, and it continues to grow the momentum, the energy is really rapidly growing, I would say, both nationally and internationally, and I love being part of that. I really believe that creativity is a powerful force in human flourishing, in well-being, and can be a specific tool in terms of health outcomes. And I think we're part of a bigger change which is going on, which is in a sense challenging the biomedical model, and really the belief in psychosocial responses to ill health, and in our attempts to create healthy societies is there is a shift happening, and we can be part of that. We can be part of that change. We were asked about principles and broad brush stuff, not case studies as such, but one of the things I'm interested in, which I'd sort of like to put out there, is at a policy level, is around place-based, this notion of place, which some of you will, I'm sure, be familiar with. It's a sort of jargon that's used both by the Arts Council and local government and health around the notion of place, and that, to my mind, links. And it depends what your geography is. You might consider your place to be your village, you might consider it to be a larger urban conurbation, you might consider it to be your county in the case of many of the rural touring schemes, I should think. And so what does that mean? What is it to work at a place level? And I think it links to notions of integration, so ideas around integrating services, sharing budgets, sharing thinking around shared endeavour. So that sort of collaborative way of thinking in a policy level, I think we can also, from a more grassroots up level, support. So really, I'm just here to make the case for more partnership working, more collaboration, more consideration of the whole health of the communities you work in and how your work might contribute to that and be part of that. And so just in terms of lessons I've learned, I believe really strongly in a sort of strengths-based, or sometimes it's called asset-based approach, so really trying to look at what people can do. And I think that's one of the things that the arts brings to the health discussion, which is very often focused on what people can't do, on illness, on disability, and I think the arts is very good at looking at what people can do and celebrating that and growing that. So I work on the principle of sort of growing from your strengths outwards, your circle of influence, and not worrying too much about all the bad stuff you can't change, but you're putting your energy into what you can change.
Thank you. Cerin.
Thank you. So I think I'm on this panel because I see live arts as pivotal to the health and well-being of rural communities. Arts Alive have about 140 volunteer promoters who are putting on over 100 live events annually and more than 1,000 films as part of Flicks in the Sticks programme. But according to figures that were published by the government last year, more than 9 million people always or often feel lonely. A third of people who go and visit their general practitioners aren't unwell, they're just lonely. They just want to go and chat to somebody. And I think probably as more people live and work alone, as we spend more time online, it's very important that we don't lose those opportunities for in-person social interaction. And rural arts events obviously have a key role to play in keeping those communities vibrant and healthy and connected, and those conversations Paul was describing after watching a live piece of theatre, invaluable for those people, those 60 people in that audience at that time. Loneliness causes poor health and leads to premature death. You know, these are terrifying statements of fact. But we also know that if you reduce loneliness, people can lead independent, happier and healthier lives for longer. Our population's ageing. We've all talked over the last few days about the demographic of a lot of our audiences. Natalie in particular referenced her 65 plus cohort. And 1 in 3 of us is going to start living with memory loss, even without a formal diagnosis of dementia. The creative part of our brains is the very last bit that is lost when you lose your memory. And so being part of a live arts experience in your community, I think, is absolutely crucial for people living with dementia and for their carers in those communities. Work in rural areas offers opportunities for engagement which might have been lost in that individual or that family supporting the individual with living with dementia's lives. The Arts Alive and Flicks venues are beginning to embrace becoming dementia friendly, and going back to lots of words from yesterday, being inclusive. Hannah was talking about it, Phil was talking about it. Inclusive venues. Venues that are local enough to feel familiar and are accessible. As part of our recent Celebrating Age-funded project, Creative Conversations, Arts Alive was able to place a show called Curious Shoes in a number of rural venues across Shropshire. It was a dementia-friendly performance that had been created alongside a focus group of people living with dementia, for people living with dementia. And I just wanted to read just a couple of responses that came from those audience. Not that it needs to be validated why we did it, but I think this does give an insight into why it's so important for people's health and well-being. The person living with dementia said, "We were interested in you and you were interested in us. I felt loved." These are all people living with dementia that said these comments. "That's the first time I've danced in 17 years. You need to hold me up." "Jointed and disjointed, just like life with dementia," said the wife of a person who is living with dementia. Brilliant, excellent. My mum really enjoyed that. She's usually quite reserved. She was really stimulated and engaged, the son of a person living with dementia. "I saw a little bit of mum," said this woman, the daughter of a person living with dementia, "through the fog. I haven't seen her smile like that for ages. She was putting sentences together. It's done her the world of good. We need more of this. Come again." And there's thousands more amazing comments just about the power of that one engagement, interactive performance. There's a real challenge programming for disparate communities. You all know that, those of you that are involved in programming for rural events, and finding work that will engage and enrich the lives of those communities and support, of course, their health and well-being. The government's funding towards community healthcare in Shropshire is going to be spent on social prescribing. Alex has referenced this already. GPs in Shropshire are able to prescribe arts and leisure events as a prescription to help and support their patients' health and well-being. Arts are the best medicine. In a little rural market town near us, in Bishop's Castle, they're developing a poetry pharmacy. You can go in and have a poem created to cure whatever ailment you walk into the pharmacy. This is the way forward. This is absolutely the way forward. So in terms of things to ask me about, do ask me about dementia-friendly performances, dementia-friendly audits that we're going to be putting on the Arts Alive website so that people have a checklist to make sure that their venues are inclusive for people living with dementia. Ask me about social prescribing and ask me about celebrating age. Thank you.
Thank you very much, Cerin. So I do apologise. I'm really not important, but I've realised I didn't introduce myself. I'm Chris Bridgman. I'm the scheme manager. I run the Arts Out West Rural Touring Scheme in West Cumbria. Victoria.
So I'm here because I am the director of the Culture, Health and Wellbeing Alliance. It's still a relatively new organisation. We've been around for about a year. And we're there, like Arts and Health South West, but on a national level for everybody that believes in the potential of the relationship between the arts, culture and health and well-being. So we have a membership of about 4,000 people. That's growing quite fast. It's free to join. There's a bulletin that goes out monthly. We have a website that we're trying to develop into a real resource for people that want to find out more about this work. So for some of the things that you were just discussing would be the kind of case studies and programs that we'd like to be highlighting on the website, for example. So we try to be as grassroots an organisation as we can. So we're guided by a steering group that is 2 regional champions in each of the 9 English regions. So we have a museums champion and an arts champion, and they buddy up with lens champions. We have a group called the Lens, which is for people with lived experience of the transformative impacts of the arts and culture on their own health and well-being, and they also constitute regionally, so we try and keep those our champions and the Lens champions as knitted together as possible. But we also work with a lot of national organisations, so the NRTF is a Strategic Alliance member, along with organisations like Live Music Now, or Paintings in Hospitals, or the Museums Association, and we're trying to figure out ways of sort of keeping the conversation going about health and wellbeing across all these different groups in a way that is as productive as it can be in terms of influencing policy, I guess. So that's why I'm here. And also, me and Alex were commissioned by Holly to write a response to the Consultation report. So you'll see that coming out, I imagine, in the nearish future. But the other thing is that I'm from rural Dorset. I'm spending quite a lot of time there at the moment looking after my elderly mum. So I'm thinking a lot about social isolation and culture and the arts. She is an artist, or has been at various points in her life, and is struggling to access that now. So yeah, I'm sort of in that world of thinking, I guess, at the moment. And I'm a musician also. I would like to be a touring musician, but at the moment I'm a static musician. So, but I make work about experiences of health using interviews with people. So, we were asked about our driving passions. I've been doing this for somewhere between 20 and 30 years. I ran a hospital arts programme for many years, and when I started doing that, it was all very new, really. I mean, there were some programmes that have been around for a long time, but most of us, you never met another hospital arts coordinator. And so we were all making it up as we went along, really. Alex had a similar experience, I think. And you learn, I think you sort of think about the ethos of the work almost after you start doing it in those situations. I was quite young when I started doing this work, but I saw very quickly how bringing the arts into those kinds of spaces does something to hierarchies and changes relationships between people. If you have an exhibition where a porter's watercolour is winning a prize next to the surgeon's picture that doesn't win a prize, it does something quite interesting to the dynamic of the room. And similarly, if you take music into a space where somebody's being cared for, it does change the relationship between the carer and the cared for, because they're suddenly experiencing something on a level, and they're both having a relationship with that art that is quite different from their relationship with each other. And it's the sort of shift from having stuff done to you to being to participating in something and being a critic, or having an active role in that. And I think what drives me now is thinking about that kind of shift at a more macro level, and how the arts can sort of act against the forces of inequality, if you like. And that was sort of a running theme I felt in the awards last night, that there's a kind of subversiveness about it, I guess, in the best possible way. And I was trying to read François Matarasso's latest book, and he talked about art making as a sort of safe space to experiment with our culture, and challenge the things in society that we find problematic. And I think that's part of it for me. But while Paul was speaking, I was thinking again about how, and you alluded to this as well, how important those conversations are that this work can catalyse, and that catalytic role seems to me to be crucial. And Alison, I was talking to Alison from Fish House Theatre last night. I don't know if she's still here. Yes. But we were having the same conversation about those conversations that come up after a performance or because of a performance that people have struggled to have in other contexts in their lives, and how, that's an incredibly important thing. Driving passions, lessons. What lessons have I learned? One of the big lessons for me has been that health and social care can seem like these huge, impenetrable constructs when you work outside them, particularly if you're a freelancer or you're working in a creative practice. And the thing I learned quite early on is that actually they can be quite open spaces, more open than we expect, more welcoming, more flexible, which has been a great thing to realise. Another thing, when you work in quite a sort of specific sounding area like arts, health and culture, it can get a bit territorial. People can get quite jumpy about feeling like they're the first person that's ever done it. I just did that when I was talking about the hospital. And it's not, I think we've sort of come to a much healthier point now, because there's much more of this work. As you were saying, it's becoming much more a way of thinking about work. And I think we've had to forego that instinct toward territorialism and realise that this is quite a chaotic emerging space, and that that's a very healthy thing in itself, and that it's not going to be a coherent body of work, nor should it try to be, and that seems like a positive shift. I think another thing is that community and collective action seem to me to be the way to affect change, but I grew up in a much more individualistic way of thinking about the world, so and I'm wondering at the moment whether creativity sits somewhere between that individualistic way of thinking about the world and a more community collective way of thinking, and whether there's something about that. that it can sit in that tension somehow in a productive way. And the last thing is that I've really found working with, particularly when I've been making work about complicated health conditions, that even in the most extreme circumstances, I think we reach for narratives that help give us meaning, and that the arts and culture can help us do that. They're a tool in that sense. So ask me about, I've worked as a musician, I've worked as a researcher, I'm now managing this alliance, I've worked as an arts manager, so ask me about any of those things. Or anything else, really.
Recipe tips.
Yeah, no, not recipe tips, I'm a shocking cook.
Thank you. Paul.
Excuse me for reading off the phone, but I just remembered that I couldn't remember what I'd written, so I'm just reminding myself. So I'm going to be talking kind of as a practitioner in this kind of setting. So while I'm on this platform, I have worked professionally in both the health and the arts sector in parallel for 15 years, and this has informed my practice. I now find myself in a position to help these two sectors work together under the umbrella of arts and health. My driving passions is I grew up in a small rural community with a lifelong chronic mental illness. No one ever talked about mental illness, which left me desperate and alone, going back onto your point. And at the age of 21, I had to leave my community so I could start my journey to recovery and acceptance. I have never been back, and I make work so others don't have that experience. The principles, I would suggest, if you make work about an issue, research it thoroughly and stay true to that research. Do not change the facts to fit your narrative, kind of picking up your point there. Stay authentic. Recycling stereotypes and perpetuating myths can cause harm and hinder progress, and authenticity can change lives. Lessons I've learned: think about your audience at every stage of development, not just at the marketing stage. Having someone see your work, to pay to see your work, is a privilege, and it's not one that should be taken for granted. Always ask why the work is important to you and therefore to others. Have faith in your audience, allow them to draw their own conclusions on any issue, even if it does not match your own. Ask me about access for hidden disabilities.
Thank you very much, Paul. Just before I throw it open to the floor, Victoria referred to the fact that she and Alex have been asked to create a response from a health perspective to the Consultation report, and that response exists. I'm not sure when it's going to be launched on the Waiting World. Holly, do we have a... Imminently. Perhaps either or both of you could give us a bit of a sneak preview about the kind of the broad thrust of that response to the Consultation research that I think we all know about.
Yeah. I mean, I think that the thing that we most wanted to respond to was the potential.
Yeah.
But also we were just reflecting on just being here these 2 days. We've realised there's a lot more going on than we know, and that's in the report. And I think Holly would say the report wasn't commissioned to reflect specifically on health and wellbeing. That's really becoming a more interesting area. So inevitably the report didn't necessarily pick up on existing activity. So some of our response might be a bit like, yeah, well, we're already doing that. We've obviously reflected on the work we know that connects to rural touring, but we had some specific areas that we focused on. Do you want to?
We did. I think we looked a bit at the roles of the promoters and volunteers and how there might be some work that could be done around information, really, more than anything else. I think a lot of it's about, as Alex said, this work is already happening, and in some cases that's being articulated overtly, and in some cases it may not be. And it may be about sort of education and information so that people feel more confident connecting to the health and wellbeing agenda and can confidently say we are addressing social isolation or loneliness. You probably are doing it already, but it may not be something that you're easily able to bring into your funding applications or reports, so that maybe some support around using things like the wellbeing measures or loneliness measures in the way that you assess work, or again you may well already be doing this, so that's just a suggestion. What were the other things we thought about? We looked a bit at research generally, and I guess that's what I've already said really, just thinking about how the research that's already out there can support the work that you're already doing, and there's a certain amount of resource on our website already, and we welcome suggestions of how we can improve that so that it really suits you. We were looking a little bit at the impact on health and well-being of the volunteers themselves, because obviously that's your workforce, and the impacts on health and well-being of volunteering are fairly clear, although it can flip in the other direction if you're overburdened. But yeah, I mean, there's some specific things in here. I'm sort of hesitating because I haven't memorised it myself, and we've only just sent out the first draft, or a draft to Holly. So yeah, I'm going to keep looking at this while we're talking, and then if anything comes through.
And Alex, could we just refer to the cross-party report that you were involved with a couple of
Yes,
years ago?
I mean, I'm sure quite a lot of you know about it, but I have brought a large number of the short report copies. They're on the front desk if anyone hasn't seen it and would like to take one. They're quite nice and neat. I wouldn't recommend carrying around a large report, but you can get it online. And that was published 2 years ago, so we're really in a phase of trying to support and implement the recommendations, of which there are 10. The recommendations are intended to influence the infrastructure, if you like, at multiple points, so entry points from different organisational perspectives. So in terms of this discussion, I think some of the most relevant ones would probably be recommendations 3 and 4, which are a bit about this place-based stuff. So recommendation 3 is that if every NHS trust, every clinical commissioning group, every local authority, every health and wellbeing board, I think that's identifies a champion who has that sort of responsibility to make the connection between arts and culture and health and wellbeing. Letters went out to every single one of those across the country with a report from Lord Howarth and somebody relevant, a sort of peer of in their world, suggesting they did this. We've had a relatively small response, but quite a good response across the country from all sorts of different people, and we're trying to keep pushing that. So if you know anyone, any board members of any of those sorts of institutions, or any of your board members happen to also be, you know, on a trust board, a hospital trust board or whatever, try and encourage that idea that if there's a point of contact, and their responsibility is around their policy, and then we're working with NHS providers, which is a big network, LGA, to create a sort of mini toolkit for them so that they know how to make connection at their local level. And integrated care systems, recommendation 4 is around the health structures that are coming. I don't want to get too jargonistic, and you can ask me more about it if you want, but I was, for instance, in Dorset, I think there's real potential because their health structures are pretty advanced, because they're a vanguard. They've got an integrated care system, primary care networks everywhere, link workers for social prescribing. So it's sort of already in a place where you know who you want to talk to. So I think there's work to be done at that sort of strategic level. But do take a look at the recommendations. There might be other ones in there you're interested in, like influencing arts or medical education. You never know.
Good, thank you. Right, Charlie, you on fell running duty. So please, first hand up there, and next. Please don't follow my example. Identify yourself first, and then fire away.
Thank you. My name is David Lane. I'm a promoter with Lyman Local in Derbyshire. To put it in context, in the 2011 census, 34% of the residents of our village were aged 65 and over, and 10% of the people in the village were living on their own. So last summer we put on a performance specifically designed by Vamos Theatre for people living with dementia and their carers, which was very successful. But I did actually feel a bit uncomfortable in segregating them from the mainstream audience. So my question to the panel is, what advice would you give to a promoter like me about how to integrate the specific audience into the mainstream so that the wider audience understands more about the issues that people living with dementia and other mental health issues have?
Thank you for your question, David, and great that you put that performance on. I think there's a few responses to that, really. I'm a dementia champion as a volunteer. I've done some training with the Alzheimer's Society, and I can now do dementia friends sessions with anyone in any community. It's a 45-minute awareness raising session, which allows all those people that have been partaking that training with me to then be dementia friends. Just by raising awareness in a community, it makes people feel much more included and doesn't divide those living with dementia from those not living with dementia. So that's one thing I would definitely recommend, that there's some dementia friendly and dementia awareness training across your community. The other thing that's really crucial is that people living with dementia are part of a decision-making process about programming. You only need a very small focus group, but someone living with dementia and their spouse or a family member that's supporting them, in my opinion and my experience, that's always been the way that we've been able to find work that's appropriate, but also think about how we market that to be inclusive. So many people living with dementia hate the word dementia, you know, because of its connotations to being demented and sitting rocking in a dark room. And, you know, the reality is there's 115 different types of dementia. And it has to have some kind of umbrella term, like mental health. You know, it is a mental health issue, dementia. But my advice would be consult with your community, speak to people out there, find out whether it needs a label. Could it just be called an inclusive performance? Does it need to be called dementia friendly? This comes back to yesterday, doesn't it? And I feel a lot more comfortable with using those terms. The underlying thing is that, and Hannah, who's one of our promoters, and we're looking at doing a relaxed performance in one of our village halls quite soon. And we probably won't label that in a way that will put loads of other people off that might not need that specific type of special performance. But yeah, it comes back to what we were saying yesterday about let's get rid of the word diversity, let's call it inclusive. Is that what we decided? Yeah. Just checking.
Philip said it, so it must be so.
Yeah. I hope that helps, David.
Yeah. Paul, have you got any other reflection? I mean, you talked about how successful Shanghai's presentation was, which wasn't marketed specifically.
Yeah.
But have you got any thoughts about that?
Well, I think you touched on it in the question. It's not just, it's about educating the audiences as well in a wider, to be more accepting of, you know, I go to relaxed performances, I spend a lot of time in the disability forums, and just say there's, I've been to talks and there's people with Tourette's. You know, we're very accommodating, we understand, you know, because we're in a disability forum, we just accept everybody's needs and behaviours and just accept it. But there are real issues that within a more kind of wider public setting is that we had an issue with we had captioning in our performance in the studio. The theatre were very concerned because they were doing it for the first time on tablets, and they ended up segregating our deaf audience because they felt that the audience was complaining that people are holding a screen because they spent a lot of work getting people to not use their phone. And we were very uncomfortable as a company saying that's not our decision to segregate. We'd done the captioning of the screen, so that meant they could sit where they wanted and not be forced into a corner. And then the venue were thinking of the wider general public and what issues they might have, and ended up segregating the BSL, which we were uncomfortable with as a company. So it's not just us as makers or as us as promoters, it's what work can you do to get the general public to understand that these needs, you know, are being met and this is why they're being met.
So a question down here.
Where's it go? To Hannah.
Hello, I'm Hannah Pryor, board member for Arts Alive. It was just a quick question to Alex, actually. I just wondered, you talked about people who are connectors between health and arts and culture. I wonder if there's anywhere we can access a list of those people within our regions, if there has been an uptake. Is there anywhere that that's actually documented?
The champions.
The champions, yeah.
Yeah, not yet. We're still trying to recruit them, so you know, I'll know if there's one, and you could ask me, but we're not quite at the point of we haven't even asked their permission whether we make them public public to mass attack. I think that the regional champions for the Cultural Health and Wellbeing Alliance at the moment are our most public-facing network, as it were.
Okay, thank you.
There are in Shropshire, there are these connectors. Those people are in post already.
Oh, I think I was talking about champions, not the link workers. You mean the link workers?
Oh, what were you asking about?
Yeah, it's a slightly
Beg
different
your
network.
pardon.
Yeah.
The other group to maybe alert you to is that the Arts Council have health and wellbeing champions now within their structures. So there's, I think, oh yay!
Rosie Cross, co-director of Highlights Rural Touring Scheme in the North. Really, Victoria and Alex, and maybe just a lady from the southeast up there. I just wondered whether arts and healthcare is mentioned in the draft 10-year Arts Council strategy. Ian reminded us yesterday that rural only pops up 2 or 3 times in this draft strategy. And if we're to get a toehold, if we can't use rural, maybe we can use isolation and arts and healthcare. I'm sorry, I haven't read it. Can you tell us?
Okay. Can we get the mic up to...
Hang on, Dulcie.
Hello, sorry, me again. So that whole element around 10-year draft strategy, I've got 2 points that I want to make. The first is in terms of rural. What we're doing is that we have themes across the next 10-year strategy that you can feed into. And one has a particular focus around communities, villages, towns and cities. And for me, the point of the health agendas and environmental considerations and all these wider aspects that feed into communities in those broadest senses hold rural consideration, urban-rural bordering, all of those communities where we know we need to be placing and taking work in terms of areas of low engagement. So I know it may seem that rural's only written twice, but in the psychology of the wording, I feel it's gone in our favour and everything's going down that route towards engagement of area, looking at placemaking, working with CCGs as much as the local dementia volunteer network that are supporting carers. So there's something for me in the strategy about that. There's also that consideration around quality and what that looks like and taking that into healthcare settings. And then on a third aspect, there's also the consideration for everyday creativity from life to death, where we're looking at supporting people to live greater, better lives healthily through arts and creativity, so that it doesn't necessarily get to that point where arts is cutting in at a health intervention stage and crisis, and how culture in that broadest sense of well-being can inform every person across the country. That's where I place my interpretation and recognition of the strategy. The other aspect of, I want to pick up on one other element. It's around the lens networks and the opportunities to feed in and own and shape your experience and progression and where you come from. And I think intersectionality plays beautifully into this, where you can shape your local provision from any hat you're wearing, whether it's a volunteer for a rural touring organisation or that you are a carer yourself and taking that forward. So the point for me is that Arts Council are looking to gain as many voices as possible through enabling this level of work so that it isn't solely an echo chamber the whole time. And now is that moment to feed into that strategy and make sure that's demonstrated further. So I hope that answers your question.
Thank you very much.
Can I just add something about that last point you made, Dulcie? Because I think that we've been working with the lens that came out of the parliamentary inquiry, in fact, and the people with lived experiences, the language we use rather than service users or whatever, being part of the inquiry process and always present at every event and discussion. And obviously that notion about service users is quite a health and social care space, and you may not think like that, But I do think if you can start to consider that, it's around the people that you think might benefit. How is their voice in your work? Where is that voice? Are they in the room? Are they in this room, for instance? You know, how can they become part of this discussion? And actually, we're really interested in how they can come into the workforce. Obviously, that's also through volunteering and so on. So I just sort of put that out there as another thing to hold in your head.
And just to add, social prescribing is particularly labelled and termed, and that consideration around a use of a governmental term that could potentially be a trend, when actually we're looking to ingrain this level of commitment. And that focus in its broadest sense, like Lord Howarth states, around it being community development, and that we're doing it already. And okay, another label may have come across that you may feel you fit and can aid funding or whatever, but we're all talking about the same thing. And I think there's a danger in terms of the health sector where they may have a potential narrow view of what that could become. And I think that's Arts Council and the sector's opportunity to go, no, actually, we're already owning this and we're already taking it in that direction. And how can we have that broader conversation around the link working role and what that can mean? So, yeah.
Sian, just behind your right shoulder, and Natalie, I've seen you.
I'm just going to throw in, if you want to respond to that consultation process, it's open till the 1st of September. If you can't find the documents via the Arts Council site, you can find them via our site. And the new draft strategy is surprisingly short. So it's not too daunting a read, if that's putting you off.
Okay, hello. I'm Alison Dunn from Fish House Theatre. We're quite new to the rural touring network. We're here as guests with Live and Local. Thank you very much for bringing us. We have 2 shows on the menu for Live and Local next year, or this coming year, and one of them is directly confronting issues of loneliness and isolation. It's called Powered by Fairy Dust, and it's a comedy. But my question was, I have a background in working in arts and health, particularly mental health, and we have in the past done wraparound stuff with conversations after shows and talking to people. And I wonder if this is directly to promoters, I think. Is that something you want to see on the thing that you get through to say, this is the show? Do you want to see that as well? We can offer X as well.
Karen.
Does that make, am I clear?
Yeah, thank you for your question. Certainly in the case of Arts Alive, we ask that question when companies fill in a profile to tour with us. One of the questions is, do you offer a workshop? What other wraparound activity can you offer as part of that package, and what would it cost us additionally? Certainly for myself, I think the way forward is always to try and have some kind of engagement, a Q&A afterwards, or meet the actor, but workshops absolutely. Obviously through the Rural Dance Initiative, most of those companies offer a dance workshop, which is taken up pretty much always by our promoters. So I would say, yeah, absolutely, go for it. Offer enhancement, offer opportunities for creative learning and for participating, rather than just being a passive audience. Let's get people engaged, enriched, and more involved. Thank you. Yeah.
Natalie first, and then the lady in the red on the right side of the aisle.
Thank you. Hello, Natalie from Creative Arts East. Firstly, just to say thank you really to Alex and to Victoria for leading the charge on this. I mean, maybe 5 or 6 years ago, I sat in a conference in Wales listening to Alex be inspirational about bringing arts and culture more closer to the health agenda. And it feels like we've really moved forward. And so I think, thank you for that. I think arts and culture have moved towards the health agenda, and rural touring needs to do that as well. And I was sort of a bit of a call to our colleagues nationally to think about evidence and impact evidence being everything in the health world and the well-being world, and that we are already doing it. The volunteers have huge personal well-being outcomes, but they don't identify, when you ask them that question, they don't identify they've got a well-being outcome, but they will tell you that they've improved their skills, they've met new people, they've got personal satisfaction, but we're not collectively, nationally collecting all of that, and so I would just put a call out for us to do that more and better. And there are some things that we've been using at Creative Arts East, some tools that we could maybe have a national discussion about, which is the Canterbury Wellbeing Scale, a new scale that's coming into the fore in the coming months through Professor Paul Cammick at Canterbury Christchurch University, and also the ONS indicators for loneliness that we could all be using and collecting, but also a bit of a call to our promoters to say sorry, but we do need to ask you and your audiences a few more questions in order that we can prove our worth on this stage here. And then it comes down to money, and I sort of I don't want to end this conversation on money, but it does come down to money. And in Norfolk at the moment, there's a massive charge towards social prescribing. And brilliant, I thought, until I realised that people want to socially prescribe without any of the money that they would be paying to the drugs company or to the gym company, or, you know, they just want to sort of prescribe onto our non-rolling, really precarious programs. And that doesn't work. But at the same time, it's difficult to have a conversation about money when we know how stretched the NHS is, when none of us want to make that any more precarious, and when we realise that all of the money for the NHS is going into firefighting and not into prevention, but all of the conversation is about prevention, and this is where we sit.
Yeah.
Do you have a comment?
Yeah. Yes. I think, actually, I would just say that there's a lot of people understand that at all levels, but it's not an easy problem to solve. Obviously, the multiplicity of social prescribing prescriptions they offer is very, very varied. It's all the sectors, in fact. And so what is happening at a national level, which Arts Council is involved in, is this Social Prescribing Academy, which brings together those, so it's got Sport England, Arts Council England, Natural England, you know, that at that level, those bodies, those arm's length bodies, who are really the providers, if you like, of all of this, how are they going to come together to better sort out the financing? If you look at the social prescribing guidance that's been produced, it does talk a bit about this as a problem, and there's a belief that it has to be multiple sources. It has to be, you know, it can't. There's no one organisation or government department that can fund the provision. It just wouldn't work, actually, frankly, their current system. So it's got to be it's got to be integrated. But NHS England are funding the link workers, but they won't fund the prescriptions. But they do expect the clinical commissioning groups at a local level to be funding the stuff eventually. It's going to take time. You've got to get involved if you want to, and if you're already in those community networks, you are already involved in a sense, but you just, there is no, we've made that point in response to support, there is no ready money. Don't expect that, because it just isn't there.
Yeah.
Can I just add something from the Wales point of view, is that, because it's a different model in terms of public health, Tamsin and I have both sat on the Welsh Government Steering Committee about arts and health, and the social prescribing and the cost came up. And one of the conversations we had opposite the table was there was a GP, and that kind of how do you price something? They don't know how to value, the model of how do you value the arts. And the way we started the conversation is, well, if you take an individual and you work out how much their antidepressants are costing them over a long period of their life, then maybe you can equate it to how much it's cost. If it's socialisation is the causes, can you then kind of take that money across and go, well, we're saving the NHS money through medication, and therefore maybe that could move over. I'm not saying that's a policy, but it's the conversation that we went down. Yeah.
I think it is, again, to reassure you a bit, although I don't think these questions are going to go away anytime soon, there are definitely conversations happening about the nitty-gritty, and certainly John McMahon, who sits on that working group for social prescribing, is is constantly being bashed over the head about this. Every meeting that I go to that he's at, this question comes up. So people are thinking about it. That doesn't mean that it's going to get solved straight away. And I just want to throw in an additional point. The other thing about social prescribing is that it is only part of the ecology of this work, and there's a risk in letting it dominate the space too much, I think, because as Dulcie was saying, there's also the question of creativity as a kind of preventive measure, if you want to frame it in that way. But there's also issues around training and support that social prescribing brings up that we need to be addressing fairly quickly. So. Okay.
Complicated here. We've got little under 5 minutes. Can we pass it to the lady to your right, Sean? Just yes.
Philippa Morn from Country Arts WA in Australia. My question's really to Paul, following on from the lady with the fairy dust. What is the responsibility of the promoter or the schemes to look after the artist in this conversation? If you're finishing every performance where people are disclosing their mental health problems to you, and your artist and potentially your actor who's not a trained for... Sorry, I'm finding this echo very awkward. Your artist who's not a trained professional and may not have the lived experience themselves, and they are being told about, difficult situations. Who looks after that person, or how does that person respond?
So to deal with the actor, question is Robbie doesn't join in the Q&As. That's simply that, because he's learnt through my experience, and he showed a willingness to do it, but we stepped in and said, you're not in a position, and we don't want you to feel not just responsible, but suddenly get stumped. So the idea is that at least one of us, Tamsin or myself, would always come out with the production, if not both. So if there was a conversation, he's not left fielding or recycling some of our answers, because we can't talk as health professionals, but we can at least talk with lived experience, what's been experienced to us, and the kinds of help that you could be looking for. So we're very clear on that. When it comes to is how promoters would look after us, again, there's a duty of responsibility on our behalf, is to actually lay out and be clear the level of support that we require, or the facilities that we might need, and if they can be honoured. So, but also not put the whole thing, it's not fair on a promoter to suddenly go, oh, we've got someone with a mental health situation, what if he hits crisis? It's like anything, there's a duty of responsibility as the patient or the service user to have those in place, and part of it is to alleviate the stress on that promoter to say, if I have to walk out and we need to cancel the Q&A, then you know why, we can deal with it afterwards, but please just accept this is what's happening. I don't know how clear an answer that is for you, but there is a thing that almost as a rider for a show, there is a rider or a tech spec that we would do to take the responsibility off the promoter.
So I suppose the message is to promoters, don't panic.
Don't panic, but also, if you have a condition generally in life, we found that Tamsin and I you can't just expect the world to anticipate your needs and then react negatively when those needs aren't met. It's a difficult conversation, it's a difficult place to get into your life, but you then have to start being honest and go, I cannot do this in this situation. And there's an ownership. And that means if we can all be honest with each other and respect each other on both sides of the argument, then it makes it easier for everybody involved.
Go very quickly, Tamsin.
So it's kind of like...
John, Mike, sorry.
If you want to see, it's got to be the last.
Yeah.
I won't keep you. It's like any access need, really. You can't expect people to know your needs, especially with hidden disability. So we would encourage the promoters to ask us or ask whoever is coming in, what are your needs and what are your mental health needs, because most of the time that's okay, because nobody expects you to be able to know how to help all the time. Does that make sense?
Okay. Yeah. Thank you. We have run out of time and we're eating into coffee consumption, which is a necessary medical application for many of us. But I do just want to take 1 minute because probably inevitably I think we just scratched the surface here. I think I'd like to know, who do we ask next to, if we're wanting as a promoter in a village hall or as a scheme manager to integrate arts in health and link it up with whatever else is going on in our region, who do we go to as the next step?
Well, you can. I would definitely encourage you to join the Alliance, join the mailing list. That will at least keep you up to date with what's happening around the country, and find your regional champion in your area. You'll have 2 in your region, the 9 English regions, but also you just come and speak to us afterwards. And you know, these are small organisations, so you'll find us pretty quickly if you email the organisation.
Thank you all very much. Can we please thank Paul, Alex, Cerin and Victoria.